Hello friends, today we'll discuss about the virology important points. So here, this will be divided into two parts and I'll be discussing part 1 now and part 2 I'll be posting it later. So first to start with, so again the classification like DNA virus, double standard, which is single standard. I have posted a separate video and I'll be giving a link in the description box. Okay, so this will be covering only an important points. So first is regarding herpes virus. Okay, so here always remember the herpes, it is an you want to remember it's a linear double standard DNA virus, and the important mechanism here, it is a rolling circle mechanism. So by that mechanism only it will be used, usually replication will be there, and HSV1, as you know, it is always through the mucosal or the updated skin contact, and HSV2 it is mainly by the sexual mode or through the parenteral mode, that is during an vertical mode, that is through the delivery time. So latency, it is mainly HSV1 usually resides in the trigeminal ganglion. The virus 2 will be resides in the sacral ganglion. As you know, HSV1 it is usually above the you can remember like the groin region, so it is usually above that, and 2 is below infections will be there. Okay, so first, the CNS infection, you want to remember it is the most common cause of sporadic viral encephalitis. That too, it will be causing a temporal lobe encephalitis. There is another term called as a moderate meningitis. It is nothing but it is a lymphocytic meningitis. So these are all caused by herpes virus. So next, it is an coming for genital lesion, it will be usually present as bilateral, painful, multiple and tiny ulcers will be there. Okay, as I told, HSV1 is usually associated with skin infections, so whereas HSV2 it is associated with the genital infections. So coming for the Zank smear, it is mainly for the diagnosis. We will be demonstrating the Lipschultz body and MNG, that is a multinucleated giant cells, and the infected cells, there will be in swelling will be there or ballooning of the infected cells. So next, what about the cutaneous lesions? It is mainly herpetic whitlow, and then febrile blisters will be there, and herpes gladiatorum, and eczema herpeticum, and erythema multiforme. So just remember the names, that is more than enough. So coming for varicella zoster, so chickenpox usually presents at, it will be in bilateral vesicular rashes. It is usually occurs in the, most common occurs in the children's only. Coming for the zoster, it is mainly because of the reactivation of the chickenpox virus, that is in varicella zoster virus. But here the vesicles will be unilateral and it will be in segmental. So coming for the complications, you want to remember all the point. The most common infectious complication, secondary bacterial infection, whereas extracutaneous it is in CNS involvement. Serious complication, it is in varicella pneumonia, and there is a syndrome called as an Reye syndrome. It is mainly because there will be an hepatic degeneration, which usually occurs following the salicylate intake. So coming for chickenpox in pregnancy, if it is associated with late first trimester or early second trimester, because of the transmission of infection, it will be very severe. And then what will happen is, if the infection is between 6 to 12 weeks, okay, there will be only limb develop, because it may affect the limb development, so that there will be an limb hypoplasia will be there. And then if it is between 16 to 20 weeks, there will be an eye and brain involvement. So as you know, there is a varicella. So the congenital varicella usually presents with microcephaly, limb hypoplasia and cicatricial skin lesion. You can remember it as MLC. Okay. So coming for the varicella zoster immunoglobulin, if a patient have been exposed, some persons have been exposed to the infected patient, you can give immunoglobulin within 96 hours. Okay. So suppose if you want to give it to the neonate born to chickenpox mother, Suppose if the onset of chickenpox in the mother is between that is less than 5 days before delivery till 48 hours after the delivery. You can go with that. So coming for the MMR and chickenpox and smallpox, there are certain points which is usually sorry, it is common for all the these viruses. So one, it is there is no carrier state and cases are the source of infection and there is no animal reservoir. So because of these points, the smallpox was easy to eradicate and high secondary attack rate will be there and all have the live vaccines. And the important point is once they get infected, they will be getting a lifelong immunity. Okay, so coming for cytomegalovirus. So it is an CMV virus. It is the most common cause of an intrauterine infection and it usually affects the 1% of the infants and then 5% of the infected fetus also will be developing in diseases. I think this percentage is not needed. It is the most common cause of an intrauterine infection. So here it is an important point, that is it is the most common cause of bilateral interstitial pneumonia in bone marrow transplant and it causes febrile leukopenia in the solid organ transplant and obliterative bronchiolitis in the lung transplant and it also causes a graft atherosclerosis in heart transplant and it also causes a rejection in the renal graft. So coming for how will you collect the sample is you will be taking and washings and the urine and cell line here it is in human fibroblast and there will be an owl appearance will be there. So coming for Epstein-Barr virus, it usually associated with malignancy and this question have been asked twice or thrice in the exams. Okay. So what are the associated malignancies are Burkitt lymphoma, nasopharyngeal carcinoma, Hodgkin lymphoma and non-Hodgkin lymphoma. Okay. So next regarding the oncogenesis, so first it is an LMP, that is latent membrane protein, and also the viral EBNA, that is an Epstein-Barr virus nuclear antigen. So these are all associated with the carcinogenic factors. So some of the EBV specific antibody detection are one is a viral capsid antigen and the early antigen and the EBNA antigen. Okay. So coming for Kaposi sarcoma, it is caused by HHV8. And it also causes a primary effusion lymphoma, that is it also causes a body cavity based lymphoma and Castleman disease, that is a lymphoproliferative disorder. Okay. So coming for parvovirus, it is a smallest virus and the only DNA virus which usually has a single stranded DNA and it usually infects a P blood group antigen. Okay. So because of that only it will be using as a receptor, so which is present in the RBC. So this is an important tabular column you want to remember here. So the erythema infectiosum in the children it usually presents as a slap cheek rashes, whereas in the adult polyarthropathy and transient aplastic crisis it will be because of a hemolytic anemia, it will be manifested as anemia only, and PRCA because of an underlying immunosuppression it causes chronic anemia. Hydrops fetalis usually present in the fetus and also present as a fetal anemia. So coming for Glauben-Sock syndrome, it will be causing a painful redness and swelling in both the feet and the hands. So coming for polyomavirus, it usually first it is a JC virus. It causes progressive multifocal leukoencephalopathy and BK virus causes nephropathy in the transplant recipient and Merkel cell virus usually causes a Merkel cell carcinoma of the skin. So coming for next oncogenic virus, that is a human papilloma virus. Here the E6 and E7. So E6 what causes it? It degrades a P53, that is a tumor suppressor gene, whereas E7 it binds to the retinoblastoma gene product. Okay. So what are the other conditions caused by HPV is epidermodysplasia verruciformis, and then it is an autosomal recessive benign condition. Okay, but it also causes a squamous cell carcinoma. It is that too common with an HPV 5 and the 8. So next it is a molluscum contagiosum. So always remember it is an umbilicated lesion with a dimple at the center, and there will be no inflammation or the necrosis. It will be found everywhere in the body except the palms and the soles. So ceiling temperature is nothing but it is the highest temperature. So beyond which the POC formation is inhibited by the chorioamniotic membrane. So it is higher for vaccinia virus, that is it is in 41, whereas for variola it is in 38. So coming for uses of bacteriophage, it is used in phage typing, phage assay and phage therapy, and also for mycobacteriophages diagnosis, and used as a cloning vector, and it usually mediates a transduction, right? Because it has two types, right? Generalized and restricted transduction, and the code for toxin and antigenic property of the bacteria. So coming for influenza virus, there is a two important antigen. Heme agglutinin causes heme agglutination, whereas neuraminidase causes reversal of heme agglutination. So here coming for influenza A, it is the most common in epidemic, outbreak and pandemic. So B is rarely seen, and C that is not much present nowadays. So coming for the test, the neutralization test, it is the most specific and it is a predictor for susceptibility of infection, and ELISA it is a sensitive test. Neutralization is specific, ELISA is sensitive. So coming for the vaccines, inactivated influenza vaccines has three types. One is a whole virus, subvariant and surface antigen, whereas live nasal spray it is an influenza A H1N1, influenza A H3N2 and influenza B virus. So coming for the pathogenicity, there is a sialic acid receptors, okay. So in the human it is usually alpha 2,6, whereas for birds it is an alpha 2,3. But in the pigs, both the receptors are usually present, okay. So that the pigs are usually prone for the influenza virus infection. Coming for paramyxovirus, so first it is a human parainfluenza virus. It is the most common agent for causing the croup. And coming for the incubation period of MMR, that is 9, 10, 19 and the 14. So friends, there is a mnemonic for the incubation period. I will be posting in the description box. So what is the most common manifestation is a bilateral parotitis. So second complication is epidermolysis, and in female it will be presenting as aseptic meningitis. So first, how the measles will be presenting us after incubation period, a fever will be there at the 10th day and Koplik spot at the 12th day, and rash will develop at the 14th day. So what are the complications is, one is otitis media and bronchopneumonia are most common. Another is SSPE, that is a rarest but it will be a most fatal one. So measles will be producing in Warthin Finkelday cells which containing both the intranuclear and the intracytoplasmic inclusion bodies. So coming for if the person has been exposed to measles patient, the immunoglobulin can be given within 3 days, okay. So but whatever it is, both should not be given together, so at least there has to be gap of about 12 weeks. So measles, which is the most common type, is globally it is a B3. In India it is a D8 genotype. So there is a strategy for measles elimination, that is in catch up, keep up and follow up the immunization, okay. So coming for the rubella, as you know, it is a classical triad of a ear defect, ocular defect and cardiac defect. And in ear defect, it is the most common, is a sensory neural hearing loss, and ocular defect, it is in salt and pepper retinopathy. So coming for cardiac, it is a patent ductal arteriosus and pulmonary artery stenosis and ventricular septal defect. Coming for RSV, it is the most common cause of LRTA in the infant, causing a bronchiolitis, pneumonia and the tracheobronchitis. So coming for rubella vaccination, you know strain CIS27-3 and it is prepared from HDCl, that is a human diploid cell line. As it is teratogenic, once a vaccine has been given, the pregnancy has to be delayed for at least 1 month. So coming for the chikungunya, so reasons for the emergence is because of new mutation of E1, A226 valent, that is A stands for alanine, B stands for valent. A new vector has been implicated, that is Aedes albopictus. So friends, just remember what's the differentiation between the chikungunya and the dengue, okay. So here the fever, polyarthritis, tenosynovitis. So as you know, dengue will be presenting with fever. So joint pain will be there but not that much severe than the chikungunya. So the rashes you can remember like here 1 to 4, 3 to 7. Okay. And coming for myalgia, leukopenia, thrombocytopenia, retroorbital pain, everything will be in dengue, whereas it will be absent in the chikungunya. But chikungunya usually presents with like polyart, that is a joint pain will be there and muscle pain will be there. So Japanese encephalitis, the Culex mosquito, it is a vector, and in India it is a Trichiniorhynchus and Vishnu. So coming for the animal host, the pigs are the amplifier host, and cattle and buffalo can also act as a host, but the horses are usually symptomatic will be there. So the humans are the dead end, and there is no man mosquito man cycle. Okay. So what's the vaccine for Japanese encephalitis is SA-14-14-2. It is an inactivated vaccine. Nakayama and the Beijing strain will be used. Okay. So here Beijing P3, it is a cell line derived vaccine. So coming for dengue virus, as you know the vector, it is an Aedes aegypti. They are the day biters, they are the nervous mosquito, and the incubation, that is an infectious between the 1 to 5 days. Extensive incubation period is 8 to 10 days. Okay, and then there is a transovarial transmission history, and the patient once gets it, they will be become infective for their lifelong. So here you want to remember one important point, that is an antibody dependent enhancement. That is, if the patient has been infected by the dengue virus, if he has infected with serogroup 1, okay, at the first time of infection, at that time both a neutralizing and non-neutralizing antibodies will be produced. So what happens is, this neutralizing antibody, it will be binding with an serogroup, and it will be, what is that, it will be eliminating the infection. But second time, if the person is get infected with the other serotype, okay, so what happens is, the non-neutralizing antibody which is produced during the first time, no, it will combine and it will protect the second serotype, that is a new serotype, and it will be eliminating the host immune response. So the second, once a patient has been secondarily get infected with dengue, it will be a very worsened condition. So you know criteria, right? There will be a fever, hepatomegaly, thrombocytopenia less than 1 lakh, and hematocrit will be raised, and positive tourniquet test of 20 petechial spots, and spontaneous bleeding will be there sometimes from the skin, nose, mouth, and the gum. So NS1 antigen test is an important test. ELISA and the immunochromatographic test can also be done. And NS1, it is usually from day 1 to 18, and it is highly specific to all the dengue serotype. Another test, it is a MAC ELISA, and that has been routinely followed here, and it can detect both the IgM and IgG antibody. So the vaccines, the live attenuated vaccine have been developed, that is a chimeric yellow with it is an yellow fever vaccines, and it is developed by Sanofi Pasteur company. Friends, I have posted a separate video for dengue vaccine. Kindly go through that. Okay, so this completes the virology session part 1. Thank you, friends.